What I've been asked to talk about by lots and lots of people is cancer. And I'm one of the clinical directors for a company called Healthy Hedgehogs. And I set the company up to give people information and advice, really. And as I said, quite often the advice and information people are requesting is about different types of cancer. Cancers are all different, and even things like bowel cancer and cervical cancer, the causes can all, sometimes be different as well. So they're often a lot more complicated than people wish them to be. But they often wonder why there aren't screening programs around for everything. And when we look at whether a screening program should be in place, the things we need to think about is there actually a test that picks up the fact that you have a cancer? And does it actually detect that it's cancer and not something else? We find that there are lots of tests that can pick up cancer, but they'll pick up lots of other things as well, infections and all sorts of things. So you end up treating lots and lots of people or trying to find lots and lots of people just to find one cancer. So it needs a test that works and is something called specific and sensitive and will detect the cancer. Then we actually need a treatment that is able to cure or reduce your problems associated with that cancer. There's no point in finding something that we're then unable to do something about. And a lot of the problems around screening is not so much now the detection of things, it's whether the treatments are actually effective. And what we sometimes find is that people can live with cancer. So prostate cancer is something that people will often just live with and they will have for years and years and years, but it will never actually diminish their life expectancy. And yet the treatments that we might use can actually do significant harm and possibly even cause death in themselves. So you need a test that's able to detect things, and then you need a treatment that's able to work. And then we do live in a cost-effective world, so what we also need is something that's relatively cheap to use as a screening tool, and a treatment that is justified in the expenditure of. And that can be problematic because if you're the person that has a cancer, then the fact that it costs lots of money to find it or treat it is not significant to you. But everywhere we have to make a decision about how we spend money. So what we try and find is a test that works really well, that isn't too expensive, and that we're not picking up loads and loads of people with problems, that when we investigate them a bit more, they actually turn out that they were nothing. So we've had to, look after people, do some extra testing, cost loads of money, put people through all sorts of stress, and then we find out there's nothing wrong. So once we've got a test that works and we've got a treatment that works, and everyone's happy with the cost of those things, we're able to offer a screening program. So the ones that tend to be talked about at the moment are the female screening programs. So we have breast cancer and the mammogram, and then the follow-up treatments. You might have seen in the newspapers even in the last few weeks that yes, we do definitely reduce the mortality rate from breast cancer, but how much do we overtreat people? And it's always difficult to know. And how we manage those overtreated people, because they won't recognise that they were overtreated because to them they had cancer, is an issue. But we feel that that's a really positive screening campaign. It's worked very well. We don't tend to use it for younger people because your breast density tissue increases, so the mammograms become a bit rubbish as a screening tool, but also the numbers of people with breast cancer become really low. So it is still important that you do examine your own breasts and that you are breast aware. And obviously you can Google to find out how to do that effectively. The other female screening program that's around is the cervical screening program, a really effective screening program. And I would encourage everyone to take advantage of that screening program. Interestingly, it's a cancer that we're looking to be able to vaccinate against in the future. So it's caused by, on the whole, a virus called the human papillomavirus. sort of a wart virus in other circumstances, but the particular serotypes involved cause this cervical cancer and cervical cancer. And what we've also found is that by giving a vaccination to young girls, that actually reduces this rate of cervical cancer. So it's really important that if there is a programme of vaccination out there, that we take advantage for that. Then the other female cancer that at the moment we don't screen for, but there is talk about it, is ovarian cancer. It's a difficult cancer to find. Quite often people present quite late at the moment, so there is a high death rate associated with it once you've got it. There is a blood test that you can do for a chemical called CA125, but the problem is it's not specific to cancer. So if you've got cysts or other problems with your ovaries, it will come up with a high value. But they're looking at if they sort of relate that with an ultrasound, whether that would make it much more specific. And they're doing active trials at the moment to see if that's the case. There are home testing kits for things like CA125. The problem with them is that it's really difficult to interpret. So if you are looking at trying to do things for yourself from an ovarian point of view, I think really you need to chat to your GP. I wouldn't go down the realms of buying anything over the counter. So there isn't really any home diagnostic tests for that. And then, as with all cancers or all symptoms, if you're actually having problems and you've got bleeding between periods or there are other issues, then do see your GP. If you've actually got symptoms, you should really be going and seeking some expert advice.